Good morning. Welcome to Bradley Airport. My name's Kevin Dillon. I'm the Executive Director. Thank you for all being here on this very brisk morning. As you know, we continue to be heavily impacted here at Bradley by the pandemic. At one point, we were actually down 97% in terms of our total passenger activity here at the airport. So we knew very early on that we needed to introduce measures here at the airport that would start to instill confidence back in our passengers. So if you fly through Bradley these days, it's a much different experience. You'll see that there's stepped up cleaning in the terminal. We've really increased our sanitizing of high touch points. We've put in measures to keep separation between employees and passengers, the TSA and passengers, and we certainly work with our airline partners as well. Many airlines, as you know, are keeping the middle seat empty as a measure to try to maintain social distancing. And we were one of the first locations here in Connecticut that mandated mask wearing within the terminal. And certainly as you board a flight today, all airlines are requiring that you wear a mask for the duration of the flight. But one of the things that we continue to struggle with in the travel and tourism industry are the travel advisories that exist in many states. And we understand the reason why those travel advisories are in place. But we felt it was very important to push for a testing option. And that's why about a month and a half ago, we introduced testing here at Bradley Airport. It's been a very popular option with our travelers in an effort to avoid the 14-day quarantine period if you can provide that negative COVID test. So today, announcing a second testing site here at Bradley is a logical next step for us because it's been so popular here at the airport. And we are thrilled to be able to partner with Hartford HealthCare. A name like that associated with Bradley, it just does wonderful things for us. They're tops, certainly in the healthcare field, and we're thrilled with this partnership. So at this point, it's my pleasure to introduce the President and CEO of Hartford Health, Jeffrey Flax. Jeff.
Thank you, Kevin, and we're delighted to be in partnership with Bradley Airport, the Airport Authority, the state of Connecticut, in this moment. Today, there's unprecedented demand for testing. Our testing across Hartford HealthCare has tripled over the past 30 days. We are approaching having completed 500 tests throughout this pandemic, and 1/4 of those 500 tests have occurred within the last 30 days. So we're opening this, our 9th permanent center across the state of Connecticut now. And opening this center next Monday, the 23rd, doing it in advance of Thanksgiving, is a critical need that we're helping meet across the state of Connecticut so we can facilitate and support safety in all communities under all circumstances. The testing, the needs, as I said, have grown so extraordinarily, and we're very fortunate that we have capacity and that we have the tests that can be administered here in Connecticut. We have built at the Convention Center recently our new testing operation where we've doubled the capacity for testing that can be administered in the city of Hartford. We've also moved our testing in Norwich to Dodd Stadium, expanding our testing capabilities. We're expanding hours of testing across the state. We have 5 mobile testing centers that go out to communities, our most vulnerable communities across Connecticut, from homeless shelters to prisons to community centers to churches, each and every day across Connecticut. And we're hiring new people into our centers to help us continue to expand our capabilities and bring as much testing, and we're working to do it as efficiently as we possibly can as we go forward. I also want to remind our communities, our hospitals across Connecticut are open, they're safe, we're taking all protective measures, and we urge people who need care to seek care and get care at this time. We have created the right protections in place to care for as many people as we can within our facilities, and our teams working on the front lines of healthcare, our healthcare heroes, continue to do this each and every day. So we want to remind people as we're in this travel season to wear a mask, to socially distance, to continue to be very sensitive and supportive of the travel recommendations, and to practice hand hygiene. It's absolutely critical during this time that each of us does whatever we can to help manage and really constrain this pandemic as it goes forward. I'd like to now introduce Dr. Jim Carden, who is a cardiologist by training, but as an executive and a physician at Hartford HealthCare, Dr. Carden is in charge of our testing facilities, all 14 of them across the state of Connecticut. So please, Dr. Jim Carden.
Thanks, Jeff. Appreciate the opportunity and extremely grateful for the opportunity to extend our testing out here to the northern part of the state. As you are all aware, the prevalence of the COVID has been increasing. The demands on testing have continued to rise, and we're working diligently to try and meet that demand, and this just gives us a great opportunity to both help travelers who are coming in and out of the state, but also the communities to where they have another place that they can come to get testing performed. Testing is a critical part for our ability to control this pandemic, but it is just a piece, and I want to just re-stress as we head into the holidays, as everybody is looking forward to meeting and getting back together with families, that we continue to reinforce a lot of due diligence to make sure you're taking all appropriate precautions. This is a serious step, and the precautions that we talk about, mask wearing, distancing, washing hands, they work. They help keep each other safe. They help keep the vulnerable populations safe. So we just need to continue to stress that over and over again as people have become fatigued of dealing with this, but it's an important step as we move forward. We at Hartford HealthCare are certainly prepared for this. There is no question that the increased demand has continued to push us to continue to expand, and we are fortunate to have partners like this to be able to find areas to where we can meet what the community is looking for. So with that, any questions? Rebecca, yes? Yeah, and give me an opportunity to explain. Some of the challenges, is, as everybody recalls, back in March, April, the real problem was access to tests. And what limited us is our ability to have the testing kits and the capacity to run these. And so we were quite restrictive in terms of who we could test. That's not our issue now. We have plenty of tests, we have plenty of kits, and we have plenty of capacity. Turnaround times continue to be favorable, and we continue to see improvement actually in terms of our ability to get results back through our partnership with the various labs that we work with. Our biggest constraint right now is just the ability to meet the ability to acquire the specimens, and we just need to all work together to continue to create access to those tests so that people can get it. So the numbers of tests really not comparable because the availability has just dramatically changed from where we were. They'll be in both. Kevin, I'm speaking for you, but they continue to be in facility testing as well.
And for this testing site, will that be for anyone in the area, anyone in Connecticut?
Yes. Yes. No, this is going to be, it's conveniently placed to facilitate travelers as they're coming in and out to make that easier, but this is open to the entire community for anybody who needs testing. So again, it's not the limitation of tests, it's how many people we can get through. So our ability here, for example, to set up 2 lines is part of what we're doing. As Jeff was mentioning, our ability to increase capacity. It is part of the reason we've moved off the current sites is it gives us more room to set up multiple lines to get people through. And the more throughput we can get, more tests we can do.
Yeah, the testing option in the airport is very popular. However, the in-terminal location, we limit only to passengers that are traveling that day. Okay, and we're going to continue to keep that restriction in place. This particular site will be open to not only air passengers, but anyone in the community. So anyone can come to the site, but we're still going to restrict activity in the terminal. But no doubt, it has helped us in terms of increasing our overall traffic at the airport.
When you say daily, you mean Monday to Friday, or is this like 7 days a week?
This is going to be 7 days. Well, I'll let these guys speak to that issue.
Yeah, it'll be 7 days a week, 11 to 7. So hours shifted from our usual testing sites because of helping handle when we think the most traffic and most usefulness will be at this site.
If you don't have insurance per se, is there someone who can pay by credit card?
Anybody can get a test, and we continue to commit that people who do not have insurance can still get tested, and they will not have responsibility around having to pay for that themselves.
Exactly, once they get that testing process, it goes through, whether it's sent back to, I don't know, Abbott Labs. What is the process as far as getting that final result?
Sure, happy to do that. And it's very important steps. So tracking these tests to make sure that we can know where they are, that they're theirs, and that we can get the result back in a prompt way is really important. So after your sample is taken, we aggregate those tests and send them off to our multiple lab partners. Those tests are then assessed in there, run, results come back to us electronically, and we then can result those tests back to the folks. We are seeing turnaround times in the 24 to 36 hours for the most part. There's always some outliers, but in general, our turnaround times have dramatically improved from where we were, and that's due to the marked investment that all of the labs have done to increase capacity to meet this demand.
Is there any concern that turnaround time will go back up as more passes?
Yeah, it's always a worry, right? Right now, though, we feel that we have plenty of capacity to still continue to expand, and most of the labs have really do have untapped capacity that we can do more testing there. So not a limitation right now, and not something that's keeping me up at night in terms of the multiple things that may be.
How many labs is Hartford HealthCare working with?
So we currently work with 1, 2, 3, 4, plus our own core lab.
Have you been tracking wait times in terms of how long people are in line at your other sites, and what are you seeing?
Yeah, and not specifically. It's where we do try to post on our web to allow people to make informed choices about where they go. And we've seen sometimes that are getting long. It's not precise, but you know, certainly longer than we are happy with, which is what's prompting all of the work here to expand testing.
So what line do you have estimated wait times at each site?
Yeah. Yes. And again, we do our best to direct people to the right site when they do call our line to tell them where they think that it's most efficient to go. We do fully anticipate we'll be able to get those lines shorter so people aren't having to wait.
Now, for those who haven't gotten the test before, what would this be like here to get a test?
So what you will do is you will drive in, check in. You'll come through the testing line. You stay in your car. One of our testing associates would then do an anterior nasal swab, wiping the front of the nose, and then put that in a specimen collection, and you're on your way.
Another question from Kevin. Can you talk just about more the travel numbers around the pandemic, and maybe here at Bradley, what you're anticipating for the holiday travel season in the coming weeks?
Yeah, as I said earlier, at the start of the pandemic, we were down 97% in terms of passenger traffic as compared to a similar time period a year ago. Throughout April and May, we were able to bring that number down to only being down about 75%. And we've been holding steady at that number. I do think the testing on any given day helps us somewhat. We've had a couple of days where it's dropped into the upper 60s. But as you can imagine, that's still devastating to the travel and tourism and certainly the airport industry. As it relates to Thanksgiving, we are seeing numbers increase for next week. If you look at the average week that we anticipate, that we just had in October, next week we're going to be about 38% above an average week, but that's still going to be down 65% from where we were last Thanksgiving. So there's no doubt we're going to continue to have impacts.
And any idea how many passengers have been taking advantage
Over at Genesis, right now, we're doing about 300 tests per day. We have not promoted that. Now that we have a second site, we will be working with the airlines to make it part of the reservation systems, that people know when you book a reservation that this exists. Here at Bradley Airport, we'll be promoting it at gate locations, advising passengers on their way out that when you return, this is available. So we are expecting that it's going to increase. We've been hesitant to do that because we didn't want to get oversubscribed in the terminal building. Any other questions? Well, if there are none, thank you very much for being here today. Thanks.